how many of you are familiar with this study right here, the Krill study? Okay. This is actually all over mental health and the ABA. It's the study that was commissioned in 2016 by the ABA and Hazelton. And it's going to be the meat of what we're doing. It's the reason why attorney substance abuse problems have taken a lot of attention recently. So it's a very short study. It's simply descriptive statistics. So if you get a chance to Google it, it's on the ABA website. It's worth checking out. The reason why we're doing this presentation is, and I've got to be careful in speaking about our colleagues at Hazelton, but what this presentation is about is it's taking apart, it's going to deconstruct the Krill study, okay? And what happens if you read the last paragraph in the study, this is the paragraph word for word, and it says, after it goes through all of these prevalence rates, it then says, sex, age, years in practice, and position within the firm and work environment are the contributors to the incredible high rate of substance abuse and drug abuse. It stops there. So in mental health and behavioral health statistics, these are simply descriptive. They're not causational at all. They're just what people are. They're either male or female, a certain age, certain number of years. So the study stopped. It didn't postulate why. Why is there such an astronomically high rate of alcoholism among attorneys? It didn't go to that degree. And that's what I started to look at. I've done this with clergy to look backwards. Why is there such rates of X or Y among the clergy? So we took this study and we said, why is this the case? What we want to look at real briefly is what does mental health, the medical community, how do we define addiction? Look at some of the personality traits that might be related to an addiction, and then start to look at the relationship between addiction and personality, and then start to postulate, is there an attorney personality that might be contributing to this, okay? Which gets a little bit dicey to speak about that in a room full of attorneys. I'd like you to just consider these questions. This is from the DC bar. This is what the DC bar uses to determine if there's alcoholism among a Washington, DC attorney. So you can see these questions. So there's 16 questions, and there's not much room for error. One yes brings you into, uh-oh, you probably need a follow-up evaluation. Just one yes, okay? So one of the things you learn in medical school or graduate school is when you take a psychopathology class, you're always cautioned not to start diagnosing your own behavior. Okay, so we want to be careful that we don't, overly pathologize what might be normal behavior. But these questions are kind of the gold standard of identifying could you or could someone require a follow-up evaluation. I put this little slide in there because your industry is not unlike my industry in that clients, patients come to us looking for an answer, but we often can't give them the specific answer that they want. So we and they live in the gray areas sometimes. And that I do think contributes to some of the stress that our mutual industries experience, which then in turn may contribute to some of the alcoholic or substance abuse behaviors. All right, so let's look at addiction real quick. What is this is called ASAM, American Society of Addiction Medicine. Just look at the words in yellow. It's primary, it's chronic, often leads to relapses, it's progressive. Okay, so if you ever come across the phrase a functional alcoholic, that's a phase. People don't stay functionally alcoholic. Sooner or later, the gig is up and something collapses around the alcoholic. Okay, so that's kind of a misnomer to say that, he's a high functioning alcoholic. Sooner or later, that goes away and they become usually, there's usually a problem. You see that ASAM speaks primarily to drug and alcohol, but recently there's been a whole push towards what we call process addictions, which we'll also talk about. Okay? What do we know about addiction neurochemistry? This is a brain disease. Okay? It's not willful or moral failure or any kind of thing like that. It's brain. Alcohol and drugs flood the brain with dopamine. It's just the way it works. Nobody can control it. You can't drink and say, I'm going to turn off the dopamine neurotransmitter. It doesn't work that way. Alcohol stimulates dopamine. And that's the reason why when we're doing therapy, particularly like couples therapy, and we ask the non-alcoholic partner, what do you guys do for fun? And the non-alcoholic partner says, nothing. Because all the things that used to produce dopamine in the alcoholic, food, sex, walking on the beach, going to the movies, can't compete with alcohol or drug-created dopamine. It's like sex with your wife is a 1x and cocaine is a 1000x. Right? It's the neurochemistry of the addiction. The other problem that occurs, and we'll see this in another slide, is the way alcohol works, it's insidious. It also affects, it's affecting the amygdala, which is the emotion center, feeling pleasure, and at the same time, it's affecting the hippocampus, which is the memory. So then you get a conditioned response. Wine, pleasure, I'm going to remember that. Remember, this is all occurring at a chemical level. It's not you just kind of thinking about it, randomly. It's happening in the brain. All right, that's the wild part about this, which really, you don't have control over that. We haven't figured out a way to control our neurotransmitters. So, as I just said, it's the yellow. The hippocampus memory starts to form around the use of cocaine, gambling, any of the addictions. So it's this combination of brain memory and brain pleasure. Okay? Progressive. Now, how do you know you're moving towards alcoholism or addiction? One of the biggest signs is preoccupation. If you or you notice somebody is continually talking about or wondering about in your own private time, you're wondering about the next trip to the casino, the next trip to the bar, the preoccupation is a big, big sign. And then ultimately, when you're dealing with a person who has an addiction in therapy, they'll tell you they were controlled by the disease. They were, the disease, the drive was controlling them. All right? More recently, and the insurance world is not quite there yet, but more recently in the medical community, we're identifying these, which we call process addictions. Folks who gamble, who overeat, tanning, gaming. We see a lot of video gaming in our program for adolescents in San Diego. Kids who just get, totally consumed by gaming to the exclusion of what we would call kind of normal social activities like sports or arts or just hanging out with their friends. Sex, spending, the internet, okay? So these are called process as opposed to substance. Substance is your drugs and your alcohol, right? But the reason why they're considered addictions is they have that same pleasure and memory experience. If you, I'll give you a good example. So about 2-3 months ago, I was in Oregon, and I was touring a hospital. And, we turn a corner, it's me and 2 other people, and this big nurse. And she was taking us around, and we turn the corner, and the nurse is all excited because we get hit by this smell of bleach. And for her, bleach was a sign of cleanliness. She got all excited. Look, see how clean we are? This is perfect. Well, the guy next to me started to wooze. And I thought, oh, wow, that bleach is really hitting him. But then it dawned on me, he had a hard time recovering from that. So I said to him later on, this is going to be a little graphic. I said to him later on, Joe, what was up with that bleach reaction? That was kind of weird. He said to me, he said, that's from my sex addiction. And I was like, ooh, this is going to be really funky. How does bleach and sex go? And he said to me that when he would go to stripper joints, the bleach was the smell that they would use to clean the floors from all the stuff. And that just took him right back to his addiction. And it was interesting because it smelled like bleach. The nurse thought it smelled like the next thing to God, cleanliness. And this guy is about to just pass out because it took him back to his addiction. The same stimulus had 3 different responses. And that's all the brain. That's how the brain is processing the same exact stimulus. So what we need to be mindful about as doctors, attorneys, clergy persons is the problems of the addiction on the professional, legal, ethical, imperatives that we have. In the field of the law, confidentiality is always at risk with an addict, either through direct indiscretion, through the chances of being blackmailed, the whole idea of preoccupation of time. There is not one addict in the world who does not experience preoccupation. The addiction becomes your primary goal. It's your act, it's your reason to be. Then there's certainly irritability and distraction. I don't know if you've ever experienced this with an addict, but when in therapy, you can tell when a guy or a gal is starting to think about their addiction. They just start blowing you off. And you actually bring them back and say, where are you right now? What are you thinking about? And they're thinking about getting high or going to the casino or whatever, and you're kind of in the way. And that's what happens often with work. Work becomes in the way. Got to get through this in order to do the next thing. There's this concept of the phantom settlement. Is that something that you're kind of familiar with, the whole idea of the phantom settlement? And we'll talk about that in a second. But it leads to a lot of client mistrust. I'm going to talk from a real quick medical perspective. What are the causes of addiction? What do we believe is causing addiction? We do think that there is a genetic and an environmental predisposition to addiction. However, not every child of an addict becomes an addict. So it's not 100% addiction, genetic, and it's not 100% environment. So it's the interaction between the two. There is a fair amount of modeling that goes on. Kids learn how to solve and cope from their adult community, their adult caregivers, teachers, and certainly parents. So if dad gets angry and frustrated and starts slamming beers, that's going to be the model for the kid. Oh, that must be the thing to do. That's how daddy does it. Okay, so there is a bit of modeling. There's some evidence that early childhood developmental trauma, when the brain experiences trauma as a child, it does develop differently. Okay, so an abused child's brain looks different from a non-abused child's brain. And there is some thought that this might be contributing to susceptibility of addiction. It doesn't cause it, but it could contribute to the likelihood. In our field, we talk about disease model. These are all the models that we were all taught in school. And the disease model is the one that's getting a lot of attention now as we learn more about neurochemistry. Okay, but you may have some people talk about the relationship between biology, psychology, and social environment. Okay, this is kind of the old stuff, the behavioral therapy. Those are like, the lab rat studies. There's something to them. We know that cocaine-induced mother rats will abandon their baby and go to cocaine rather than to nurse the little baby rat, which is kind of insidious, the insidiousness of cocaine. This is one of the models that I think we all are probably most familiar with, and that is the self-medicating hypothesis. It does have some roots in neurobiology, in that we feel a certain negative experience, sadness, neglect, and we go to medicate that. This is the one you hear a lot about, that alcoholism or drug addiction is really just trying to take the pain away. There's some truth to that, all right? So we see that there's some research that says folks who have been full of rage and anger, they go for pain meds to cool them out, to take away the rage. Folks who are cocaine addicts are more depressed, and they're looking for the lift. Now, there's some research on that, but it does seems to show that when I take away cocaine, what am I left with? Usually it's a depressive. It's a depressed person. All right. These are all and this is all in your handout. I just wanted to make the point of all of the neurotransmitters that get affected by drugs and alcohol. It's extreme, and you can just see, everything from, the cerebral, cortex with motor functioning, to the pain killing, to the reward. It's all over. The alcohol is not a good thing in excess. It's really doing a number on your entire brain chemistry. The thing to think about with alcohol whenever you go to the next social event, next wedding, next party, alcohol works from the front of the brain to the back of the brain. That's how it affects the brain. What you want to be careful about is by the time you get to the back of the brain, you're now in the most primitive area of the brain. Okay, the brain that is the most basic. That's when we get alcohol poisoning, and that's when we have things like the lungs shutting down, coma. Okay, so people, when you hear about people passing out from drinking, that's not good. I mean, it wasn't good when they were doing it when we were all in college. It's not a good thing. That means the brain is absolutely overwhelmed. It can no longer function. Everything before this is shot. Memory's gone, judgment, forget, movement. That's why they pass out. We think, well, passing out is just wobbly. No, it's the brain. Okay, it's the motor cortex of the brain is overwhelmed. By the time you're here, this is where you put yourself at risk for cardiac failure, for drowning in your own alcohol. That's just keep that part in mind. Okay, alcohol affects the brain from the front, which is all your reasoning, to the back, which is your breathing. That's how it works. Okay? Now, this is where we get a little dicey. We know in our field that there's a 50 to 75%, probably closer to 75%, that a person with an addiction, any kind of addiction, will likely have some kind of what we in the field call personality disorder. What's a personality disorder? Think about your Thanksgiving table, or your Christmas table, or any holiday table. The weirdest person at your table probably has the personality disorder. The oddest guy, Uncle Joe, the real weird one, okay? We all have personality types, every one of us, and it all exists on a continuum. Some a little bit more eccentric, to some that make a person non-functional, to just cute and odd, okay? But when we start talking about disorder in our field, it means that the personality style is interfering with normal expected functioning. With alcoholics, we see about a 21% co-occurrence with obsessive compulsive disorder. So think about the most anal guy or gal in your office, okay? Well, maybe they are or are not an alcoholic, but if they are, it's a 21% chance that they have this kind of a disorder. We see a lot of paranoids among alcoholics. We see cocaine. With a cocaine abuser, by definition from the law, it's antisocial, just by definition. So that's going to enhance that number. But we see a lot of narcissism. We see a lot of what we would call borderline personalities, those folks who have very difficult managing relationships. What we need to start to do, and this is where I was going with some of the studies that we've done, is there a lawyer personality type? Because you guys, remember, go back to law school. You knew your classmates, and I'm sure you categorized them, and some of them were real studious, some of them were kind of party people. So you have types. All of us have types. So what we wanted to look at was, what is the prevalence? This is huge. 20 to 25% of attorneys, this is from the 2016, so it's February 2016, are addicted to something. This doesn't even include the guys who are addicted, the folks who are addicted to gambling or sex or the internet. This is just drugs and alcohol. That's really high. So if we were to do 1, 2, 3, 4, 1, 2, 3, all the fours, you'd have to get out and you would be the addicts. That's really, really high. All right, it's much higher than any other industry.
Is the rate of occurrence for process addiction tracked similarly to substance addiction, or less or more?
Yeah, that's a really good question. There's such disagreement on whether or not we can even call it an addiction right now that this is brand new, this study. So we haven't even gotten to that part yet. And I think because that's not perceived as dangerous, it's much more like, self-destructive. Nobody's going to die if you're gambling all day long, but they could die if you're in a car accident. So I think this gets a lot more attention. All right, so that was mostly, drug and alcohol. This is drugs. Okay, so we've got about 18 to 20% of lawyers use drugs. Now we're not talking about alcohol. We're talking about cocaine, meth, opioids, and about 8 to 10% of the general population uses it. That's twice as much. Okay, and that's going to be you're going to see this pattern. About twice as many, the prevalence rate is about twice as high among attorneys as it is among the rest of the general population. That'll be the number that keeps on coming up. Okay, so here we go again. General population, 8 to 10, lawyers 18 to 21. All right, 25% of lawyers facing disciplinary action abuse drugs, okay, or have a mental health diagnosis. See, you got to keep that other piece in mind. We're talking about the co-occurrence of a personality mental health disorder plus the drug and alcohol. This is pretty challenging. All right. So what happened with Krill last year in 2016? They said that, of course, lawyers and physicians, there's always kind of like a little rivalry going on there. And they found that 21 to 30% almost had problematic alcohol use among attorneys, and again, about half that rate among physicians. And why this becomes important is because it somewhat dispels, attorneys have such stressful jobs. Well, okay, what makes an attorney's job any more stressful than a surgeon whose patient could die on the table? All right, so that's where this is coming from. There's got to be something else going on here. Okay, is there something endemic to, now attorneys don't have the highest suicide rate, which is interesting, but they have the highest alcohol and drug abuse rate among the professions, among the licensed professions. Now, this was wild. I found this really interesting, and you guys can think about this. In 1990, that was the last time a study was done on drug and alcohol rates among attorneys, 1990. And they found that the older you were in the profession, the higher your alcohol rate. And it was almost like the old boys saw that and said, oh my God, we're never going to do a study again. It's an indictment of us. But somehow, 25 years later, somebody had the courage to do another study. And it was 180 degrees different. Now, the youngest attorneys had the highest alcohol and drug abuse rates. And they're saying that it could possibly be because younger attorneys are more forthcoming, have greater confidence in the confidentiality of the LAP programs. They're more educated about this. It's not stigmatizing the way it was. But this is pretty fascinating. Again, in statistics, you don't see this kind of 180-degree turn in 25 years. That's pretty amazing. I think for those of you guys, for those of your practices that had young attorneys within the first 10 years, this is pretty important to know, because this is where your younger attorneys are falling into and what they might be at risk for. So what we find is that it's a relationship, a positive relationship from years in practice to addiction rates. So we have our junior associates all to the senior partners. That's kind of the trajectory. Okay, so what I find interesting, and those of you who are senior partners or who are similar to what a senior partner would be, this is what your cohort reported, that about a quarter of you began using alcohol during as a problem during your career. But I think it's pretty wild that about also a quarter thought they came into the profession with an alcohol problem. So ostensibly, this is what their college years were like. 27% of your law school buddies were saying that they had an alcohol or drug abuse problem during college, okay? And then this is, only about 15% thought they developed an alcohol problem during the course of their career, which to me would suggest that being the work of the law is not necessarily as high of a contributing factor. Most attorneys are not alcoholics, during their career. Most are not. And of those who do see they had a problem, only 15% said it occurred as a result of progressing in their career. It looks here like they're entering the career with a problem, okay? And the problem is kind of becoming more florid during the earlier stages of their career. So we see that unlike 1990, the 2015 data says lawyers under the age of 30, your youngest lawyers, about a third of them are acknowledging an alcohol problem. You need to be aware of this if you're in any level of responsibility in your firm next time you guys go to a party and you see your younger lawyers. Now, I don't want to say we should start stereotyping and profiling, but you need to be aware of this. This is out there. So lawyers, think about this number, right? 26% under 40, a third under 30. It's a fairly large number. Now, we're not adding them per se, but it's a large number of attorneys who perhaps could have a problem, right? So we do need to at least be aware of it. All right. When I presented this to the California bar, the question they asked was, well, can you speak to the effects on the profession? And again, you may be aware of it in your own experience or among your colleagues, the obsession with time. The addiction becomes your God. And work becomes, and relationships become something you got to get through to get to the addiction. Personal relationships, money, work responsibilities, they're all sacrificed in order to pursue the addiction. This is just the nature of addiction. So the money, the paycheck, doesn't compete with the cocaine. The cocaine high is much more satisfying than the paycheck high. For those of us who perhaps are not in an addiction, that maybe doesn't make sense. But that's the way the brain processes it. That's the insidiousness of the disease. Eventually, and this is what really frustrates the loved ones, eventually those activities that used to produce the high in the reward system, they fall by the wayside. So now, giving my wife candy and flowers is nothing compared to chasing, a slot machine or an addiction, right? And this is really tough. When you do couples therapy and the non-addicted couple, the non-addicted partner, reveals that, it's really tough for the marriage or the relationship. I wanted to, again, for the bar, they asked, so I just wanted to highlight, in yellow, the words that really describe the addicted attorney: impaired, inconsistent, delusional, neglectful, misuse, lie. And it's not just an attorney. You would say this about anybody in an addiction. And then how does it really affect your practice? Well, we have lots of stories of attorneys and other professionals, accountants in addiction. We have stories of priests who steal from the poor box because they're addicted. Okay, so this is how the professional world, how your practice can get negatively affected by drugs and alcohol. It's pretty wide ranging. There's a phenomena called the phantom settlement among attorneys in an addiction, where they start paying settlement cases out of their own pocket and try to fake it to the client. Of course, that has lots of other ramifications for their home life and their personal life. But then when the client finds out about it, the client feels as though they've been cheated. Maybe they could have made more money. Maybe the settlement could have been better. But this is actually apparently it's more frequent than is publicized. It makes the literature. When it makes the literature, it means it's out there. There's some cohort of folks who are doing it. In 2008, the bar in California looked at the disciplinary actions and the relationship with those in alcohol and found that 90% of serious attorney matters, disciplinary matters involved alcohol abuse. 90%. I mean, that's huge. Now, the disciplinary action may have been stemming from something else, and then when they, deconstructed it, it involved alcohol abuse. 60% of legal malpractice claims involve alcohol abuse. This number, 60%, is almost similar to the number of, if you follow clergy pedophile stories, it's a very similar number. The number of clergy involved in pedophile cases involving alcohol is in the high 50s. Alcohol is really not a friend when it's abused. It really creates a lot of problems here. This is the whole, when we start to talk about causes. Now, we can't really talk about cause per se, but we can start to postulate, or at least hypothesize. Think about the last time you went to an event with other attorneys, a professional activity where there was no alcohol. Was there ever an event like that? Right, okay. It doesn't exist. Maybe your first year of law school when you were all underage, but that was probably snuck in. All right, so one of the theories is that attorneys, not unlike other professionals and clergy, think because we solve problems, we really can't have that problem. We know what the problems are. Okay? That's another word or phrase for denial. Okay? So the thing that you find out in our field, when you start to work with folks who are impaired, nurses, physicians, doctors, attorneys, priests, you find a lot of denial. Okay? And because your field is probably the most articulate in your training, your ability to master language becomes, your denial friend. You can put a spin on things, all right? And it's an easy way to kind of minimize, reconstruct, some in my field would say distort your own behavior, all right? You are at risk when you start working more than 50 hours a week. And I would gather that, or postulate that it's very hard to find anybody in this room who's working fewer than 50 hours a week if you're working full time. But this is a risk factor. It's a risk for anybody. Right? And your industry probably, along with advertising, is probably the two most grueling as far as work hours. It's a risk factor. Just keep that in mind, okay? We kind of have established that there is a fairly robust relationship between alcoholism, drug addiction, and the legal practice, okay, or lawyers. Now we want to look a little bit about, what about mental health? How does the field kind of, fare when we start talking about mental health issues? And I have to be mindful that I'm not a lawyer, and my most recent experience of law is How to Get Away with Murder. So I've got to make sure that I'm not confusing that with reality. But I'm reminded of one of the episodes in How to Get Away with Murder where I guess Viola Davis was talking about we don't cry in law school. And I just happened to find this. There's no crying in law school, okay? So stuff it. So what do we look at when we look at lawyers? All right, we know that lawyers' alcoholism, drug addiction rates are about twice the average in the general community. Depressed lawyers, about 28%. General population, about 7%. Woo, four times more depressed. Pretty wild. Anxiety, 19% versus 3%. Now that really didn't surprise me. I was a little surprised by the depression, but I mean, I know you guys live in a very tense world. The nature of your business is very anxiety producing. I was surprised at depression, but not so much anxiety. And of course, stress and anxiety are cousins. They're first cousins, so they go ahead. But look at this. I mean, this is significant. This is 1 in 5 and 1 in 4. Plus we had 1 in 4, 1 in 5 with drug and alcohol. Your industry is either creating, which I'm not so sure, or attracting, and probably what's happening is there are some folks who might be predisposed to all of this. They get into a situation that nurtures it. And that's what I wanted to look at, because that's what Krill and the Hazelton study did not do. It didn't then start to postulate why. What's going on here? All right? Very high rankings in depression and suicide, but not the highest in suicide. Twice the rate of alcoholism. Now, the thing that we need to be mindful of in my field, and this is what we do when we work with impaired professionals, is that 15% of people who are depressed who don't get treatment try a suicide. They try to suicide in some way. Okay, that's huge. That's why we have several suicides a day in this country. It's very, very high. There is a correlation, and think about this: correlation between income. When your income goes down, say you're an addict and you start sacrificing your career, income goes down, alcoholism's going up, suicide risk goes up. It's kind of intuitive, right? And the data does suggest that. All right? Now we start to look at what about the profession? You guys live in a complicated, complex profession, a lot of pressure, somewhat cutthroat. So then we start to look at what does this kind of an industry do for the folks who work in it, and you can see high levels of anxiety, depression, and mood disorders. 1.33% more likely to suicide than the general population. It's still not as high as other entities, but it's still greater than the general population. Depression, we saw this a couple seconds ago, 40%. If you're teaching, almost half your classroom of law students are depressed. Right? This is a self-report from God bless, from law students. 40%. That's a lot. It's a lot of depression. All right? Again, the 3%, 3 times more rather likely to be depressed than the general population, and twice as much to be addicted to a drug or an alcohol. Why is that important? It's important because go down here, we see people who are addicted have a 6 times greater chance of suiciding. Right? When they, in Hopkins in 1990, studied law students and compared them to medical students, and law students had a higher rate of depression than medical students. And just go back to your own experience and see if that bears itself out. But it's a pretty tough population here. Right? Now, when you look at career prevalence, this is from the Krill study, the 2016 study. Attorneys are reporting 61% of anxiety, but I think that's probably, it's elevated, but I think we all have anxiety at some point in our career. This is not normal, if you will. It's not prevalent among other industries. Almost a 50% reporting of depression. A lot of people have no depression or report no depression during their career. Okay? So you can just see that those lawyers who endorse just regular old rates of depression similar to the general population had report very much decreased problems with alcohol. So this sentence here is really one of your key ones for impaired professionals because it's showing the relationship between normal levels of depression, anxiety, and stress that the general population experiences and a normal alcohol use, okay? So as this becomes less normal and more elevated, so too does the problematic alcohol behavior. All right? So why, and this is where we're going to start to postulate a little bit more, well, lawyers work long hours. Well, so do lots of people work long hours. Is there a lawyer personality type? And lawyers are really, you guys are continually getting pummeled from this side and that side. You're both a hero and a villain. I mean, there's not a lot of like negative psychologist jokes, but you guys get slammed. In the one hand, you're trying to uphold, the social compact. I mean, you're trying to keep society going and trying to point out the rules of the road. In the other hand, you're being smacked around. So it's like, whoa, there's a lot of ambivalence about that. For attorneys, it's the third leading cause of death is suicide. In the general population, suicide ranks 10. For attorneys, it's number 3. So that's a pretty important statistic.
What are the only 2 causes of death? Are those natural causes of one or
Accidents. Yeah, accidents is always one of the top ones. And when they put natural causes is kind of weird because actuarial folks are having a hard time with that because we're living so long. So now if I'm 90 and I have congestive heart failure and die, is that natural? Or is it the congestive heart failure? It's not a problem, but it's a challenge of living old now. You know, what's natural? We're all going to get cancer if we live long enough. That type of argument. So I wanted to kind of go backwards and say, is there a lawyer addict personality type that might predispose or at least contribute or sustain a predisposition? So what do we know about personality disorders? We know they're early. They occur way back, childhood, okay, very young. They're consistent. They don't change much. They resist change. These are the folks who, in your office, have very, very challenging interpersonal relationships. Okay, they could be either very quiet, reserved, or they could be overly, mood swinging and prone to anger. This is a personality disorder. Now, are we all this at some point? Of course. But when this becomes ineffectual, it starts interfering with folks' functioning, then in our field we call it a disorder. All right? So those are characteristics. You know the narcissist, demanding, fearful, that bravado. You know, it's the guy who's hiding behind the bravado. You guys know the obsessive compulsive. You know the clingy person, the paranoid person, and of course the borderline. These are your classic, again in mental health, these are the classic personality disorders that we see in treatment, okay? Where the borderline is the person who acts out extremely with little regulation. Their emotions go from 0 to 10 in about 3 seconds. Right? You may see that. You know, the paranoid person, he's the guy in the office who's always telling you to watch out. There's always a conspiracy going on. Okay? Now, we know, as I said earlier, this is in the general population, addiction and personality disorders, they go hand in hand. Okay? You don't find a cocaine addict who is not one of these. It just doesn't work. All right? And what we usually see is, by definition, we have antisocial because some of this stuff is illegal. So as soon as you do something illegal in my field, you get termed antisocial. It's a personality disorder, right? We see the narcissist, you guys know this, the dependent. Probably everybody in this room is somewhat narcissistic. It's what helped to fuel us to get through graduate school and to be somewhat successful. So that's, sometimes we can make some of this stuff work for us, right? But when it becomes so obnoxious that nobody wants to be around us, then it becomes a disorder, right? Now, what do we see when we start to look at lawyer personality traits? Well, we see self-reliance, ambition, perfectionism, and competitiveness. Why is that bad? Well, maybe it's not bad, right? It's skills. It helps get us, to a level of success. However, these same skills interfere with what we would call emotional elasticity. They don't always allow us to be as flexible as we need to be. So there's some theory that attorneys become very rigid, become very fixed. They know how to get there. When you block their goal, okay, it's that emotional elasticity that's not allowing them to solve a problem, that's kind of driving them to an addiction. It's pretty interesting because if you think about that, self-reliance, ambition, perfectionism, those are kind of solitary words. Those are kind of like me words, and emotional elasticity is much more flexible, much more fluid. So you can see where maybe this starts to make a little bit of sense. What do we see in the literature around, so I have the references in the back. What are the traits that distinguish lawyers? And again, go back to your own experience. Skepticism. Well, you've got to be skeptical. That's what the law, your training. You guys are very, very skeptical. Now, the child, the infant, is born to trust. Okay, that's the nature of the attachment when the baby is born. Lawyers start to think about the law, and their training is to ask a lot of questions, to doubt. Prove, you guys have all those sayings about, innocent until proven guilty or guilty until proven innocent or, all that. You're always questioning. Well, Trust doesn't mean questioning, typically. It's kind of the opposite of that. So lawyers question data. That's not necessarily bad. Scientists do too, okay? But that's just a trait to think about with attorneys. Abstract reasoning. So you remember your GREs or your LSATs. You guys did really, really well in abstract reasoning. So do psychologists. That's probably our highest trait. This is where psychologists and attorneys overlap. Do a lot of abstract reasoning. We can live in that world, okay? So the problem is that we can also get bogged down in paralysis by analysis, not being able to finally get closure, okay? And then there's a little exercise called drilling a hole in your own boat, where you have all this stuff in your boat, all your valuables and your best friends and all that jazz, and then you just start poking holes. And how would you solve this problem? What would you save? It's the whole thing about trying to challenge, your conceptions and your values. It's an interesting little exercise. Autonomy. Wow, you guys are really, but it goes back to what we just said, very autonomous, very independent. And the problem, of course, with that is you need to be, because you've got somebody else who's adversarial, equally independent, equally autonomous. Okay? So why do we say this? Because at 89%, right, on 100, this is fairly elevated. So how will this play in a social setting? Okay? So what we talk about is, how do we help attorneys, and you should think about this in your own practice, you could think about it, how can you get autonomy to become more collegial, involve folks in the decision-making process, which is a little hard because we already said earlier that we are fairly highly narcissistic. So inviting other people into decision-making when we think we can make the decision better on our own can kind of become a little bit of a challenge. Again, these are just traits that seem to be prevalent among attorneys. Sociability. Now, I was a little bit surprised by this, but you guys know better than I. What's the social skills level of your colleagues? Are they affable? Are they engaging? Or does their skepticism perhaps get in the way? What's their social skills like? You guys know what your parties and your work groups are like. Because the theory is, or the data says, that lawyers don't like to be too touchy-feely. They don't like to be too self-revelatory, okay? But they're very good at speaking because they're articulate about, less personal topics. So it's not that they're inarticulate, they're just a little bit more reserved, all right? So again, that's just another trait. We're not judging these per se, but this is what you've got going on. Urgency. You guys are probably among the most urgent people in the world, aside from trauma physicians. ER docs are ER docs are more urgent than you are, okay? But this makes total sense. You have so many folks, so many lives, so many experiences relying on you. And that goes right back to the pressure. But you are very high in your urgency score. You just need to get it done. Just need to get it done. And you don't often suffer other people's, babbling. This must be killing you to listen to somebody else for an hour and not be able to, interject. This is a tough skill, right? Because you guys want to get it done, all right? You know this about yourself. When one of your clients comes in and it almost starts talking like therapy session, how do you react? What is your body saying? Like, shut up, let's get to it. Or I got to listen to this. Yeah, your wife doesn't like you. She wants a divorce. We've established that. I mean, where are you with that? Are you a clock watcher? All right? Again, you know that about yourself because this gets in the way of urgency. Resilience. I was surprised at this one. You don't like when things aren't going your way, which I guess makes sense because you're in an adversarial role a lot of times. But no, you don't like that. You tend to counterattack real quick, and I would suspect that's part of your training. Rejection, not your friend. You like kind of a almost what they call warm leads. You want to know what the outcome is going to be, or you want to be very well prepared. Now, The solitary lawyer practicing who's not very resilient is probably going to struggle because they don't have the support of a group to help them deal with rejection, because we all have rejection. But that was an interesting little tidbit there on resilience. So those are the traits, and then these are kind of the types. So what kind of lawyers emerge from law school? The inspired and inspiring lawyer. Philadelphia, the movie Philadelphia, okay? Kill a Mockingbird. Those are the guys, the social justice guys who are going to change the world. The community organizers, Obama's early years, guys who really want to make an impact on community, on society. Definitely an archetype of a lawyer. You may be one, you may have part of you. Your pro bono ethic is all part of this. All right, so that's the type of lawyer. The perfectionistic one, okay? Where perfectionism, is a childhood trait. That's what we learned. We learned that very early on. That's kind of in our family DNA almost. So this is the attorney who's very mindful. This is the guy in school who knew everybody's rank. Was the first one to see the grades posted and could tell you where you were before you even got, to the hallway. All right. The super achiever. The problem with in the practice is always feeling that his esteem will be risked. These are the guys in any career who are hypertensive. Don't sleep well, a lot of anxiety. They're the perfectionistic archetype. The controller, similar to the perfectionistic, but these are the folks who need to be in charge of everything. Micromanaging, all right? And very, very fearful if you're in a private practice and you're the chief guy, the head guy. It could be very difficult for you to trust somebody else to do the work. Often pretty narcissistic, but it takes a toll on your health. Okay, these are the guys who most likely will self-medicate. These are the guys who work real long hours, come home, and have a scotch or two to go to bed. All right? All right. Now, the California bar is really interesting in that they're not really, they kind of want you guys to know what's out there in your industry, but they're not as interested in helping you overcome some of these or deal with some of these. But I'm going to put this in here anyway. But you can't tell them I did it. What can you do at work? Okay? And I know some of this stuff sounds corny. Believe me, I've sat through this where people tell me how to do workplace things. This stuff actually works, though. So if you get the time to do it, all of these little activities, right? Using technology, taking little breaks. We'll go over this stuff is really, it's out there because there's research that says if you do these things, it can help you organize your day and make it through with less stress. So this is again in your packet. Deep breathing. Does anybody here use deep breathing? It works. It works. You take a deep breath through your nose. When you breathe through your nose, it cools your thalamus. The thalamus is the part of the brain that sends all the messages across the body. You cool that out when you deep breathe through your nose and blow out through your mouth. This will work, all right? Meditate, just a couple seconds, a couple minutes, get one of those little things at Bed Bath & Beyond that has the smell or the little lights and just, do that. You're allowed to do it. Close your door so nobody thinks you're goofy. But, you take care of yourself. Meditate a little bit, all right? Just 5-10 minutes, that's all. Exercise. We know this, right? We know that the endorphin effect on exercise, and it doesn't have to be anything, is it good to break a sweat? Yeah, but you can't break a sweat at 1 o'clock and then go see a client stinking. So, what you want to do is at least take a walk around and, get your body moving a little bit. Diets, there's more and more research on what kind of food. You notice when you look at the diets here, okay, what you don't see is dairy and you don't see cholesterol, okay? So you don't see your red meats and you don't see your dairy. So kind of a killer if you're Italian and you like cheese. But but this is good stuff. Again, this is stuff that you can do. You have control. You have control over this, right? Guided imagery. Again, you all have iPads and iPhones and the whole bit. Just put one of those little TM, Transcendental Meditation tapes. Just put it on nobody will know. They'll think you're listening, to Beyonce or something. Just put that on your phone and just take, 3 minutes and just let yourself chill out. It works. This is stuff that works that you can do. Positive self-talk. This is important because how many of you, okay, skip that question. If you've ever gone into an AA meeting, or you know somebody who has, what's the first thing they say when somebody goes to speak? Hi, my name is, and I am a, okay. So the criticism of that is, hi, I'm Tony, I'm an alcoholic. My brain just reinforced I'm an alcoholic. So there's a whole model that says you never say that. You don't, because what happens is the temporal lobe, this side of the brain, starts to speak to the identity part of the brain and just says, yeah, you're that. Positive self-talk is very different. And you can use positive self-talk to help get yourself through a situation. Yeah, I can do this. Yeah, I know how to do this. This is no big deal. Positive self-talk reinforces the sense of what we would call efficacy, power in the brain. You're telling yourself again and again that you are, in a control situation. You can do something. Now, it's not Pollyanna. I don't mean to say it like that, but it does, it has to be based in reality. So you're not 5'3" saying, yeah, I can be an NBA center, but you are saying something about yourself that you know you can do, and you're reinforcing that. Very important. Positive self-talk is really, really important. All right? We know, it's almost like in our culture, there's a badge of honor that says, oh, I can get away with 4 hours of sleep. No, you can't. You just can't. You can't get away with 4 hours of sleep. It catches up to you. No, I've been doing it my whole life. I can get, okay. Well, you're probably subfunctional, okay? So this is the only one that I disagree with because I drink coffee constantly. There is a lot that says, how many guys work out after work? Do you sometimes have a hard time falling asleep at night? Oh man, sometimes I do. When you're too young. When you get older, that catches up to you. But sometimes this will keep you awake because it's just flooding the brain with dopamine. All right, so it keeps you excited, if you will. I don't have that caffeine effect. I can drink coffee all night and still go to bed. But for most folks, this is another thing you can try if it's helping you to help you go to sleep better. We know this, even on the weekend, you should maintain your sleep cycle. Just the way the brain works, circadian rhythms, right? All right. So I do want to end, just on kind of saying what we talked a little bit about, and then take questions or discuss whatever you guys want to talk about. But what we looked at was theories of addiction, the prevalence and course of addiction among lawyers. Is there a relationship between personality and lawyers and addiction, and linking personality types to addiction, and then just going over a little bit of stress techniques. This was kind of a quick version of a bit longer, where we get a little bit more into the neurobiology, but there you go as an overview. Do you have any questions, comments that you'd like to share? Yay! Thank you.
I have a question.
Sure.
I know that in certain professions, because I am in the area of negligence, that they are developing, big companies are developing, which I've heard just kind of like euphemistically called iRisk, where people are being tracked to reveal to those who are tracking them where there are great dangers associated with these types of disorders. And there are certain indicators that will reveal when a person's going from green to yellow to orange to tilt. And for instance, if you're a truck driver, where you could be killing lots of people, or a police officer, or a first responder with a gun, surgeons with a knife, obviously a little different than somebody doing a real estate contract. But still, we have people's lives. And the question is, are you aware of whether or not that type of analytic data mining associated with that type of tracking to be predictive,
You-
to
there-
prevent it, is being worked on for this crowd.
Well, I can tell you my experience with that. There's actually a meta and a granular response. There's actually a tool we use called Trigger that you populate your triggers, people, places, and things, by address, by locale, and when you drive past it or you're getting close to it, it'll alert people. When I was with I spent 10 years with the insurance world. Everybody in this room has what's called a quality of life number, based on your demographic and your utilization of healthcare services, how much pharmacy you use, how many times you've been in the hospital, your gender, your age. So everybody here has a risk number associated with them, and that kind of drives some of your, part of the reason why certain companies have higher insurance rates than other companies, if they have a higher risk pool. So everybody is part of a risk pool that will predict future utilization. The other example, I think this may answer your question. When I was with United Healthcare, the protease inhibitors came out in 1996. And all the folks who had HIV, they used to die before they would hit Medicare because they just didn't live long enough. And we went to SAMHSA, CMS, and said, what do we do with these people? They're living. We have no idea how much it's going to cost us to continue to care for them. They used to die. So we had that risk pool. So there's a lot of data mining that manages risk and predicts risk. Absolutely. Yeah.
And they're doing it in the law field too?
I don't know that they've gotten you guys. I will tell you who they do a lot on that is the pedophiles. You know, so if you go to this thing called CARA, which is out of Georgetown University, they track all priests, nuns, brothers, because it's a very risky pattern. The pedophilia risk among them is the highest of any sub-cohort. So they track those guys. Yeah. I don't know that they do it for attorneys. I think this is brand new. Your field took a 25-year vacation between 1990 and 2015. This is coming out, and this is kind of getting a lot of press. Just go on your website. You'll see your COLAP and all that. All your
And one other
cards.
supplemental question.
And
Anyway, just know that you said many times, the guys, have they analyzed statistically the difference between men and women
Yeah.
in this field? And are the women less vulnerable or
Well,
less involved with this?
they didn't, the Krill study didn't, they lumped gender together, but we know that women in the general population have higher rates of depression and men have higher rates of anxiety. It's probably a very similar stimulus. We just react to it a little bit, but there is some gender variability on that, but the Krill study didn't parse it by that. The biggest thing the Krill study did was parse it by years in practice. Yeah, the quartiles of years in practice. Pretty interesting stuff. I think what the bar wants folks to realize that this is a serious issue in the profession, and whatever you can do, there's just those little techniques you can do to manage it, and to be aware of your younger colleagues. There's got to be some pretty decent mentoring going to help those men and women out, because it's a serious issue. It really is. So, sorry.
Earlier you drew sort of a little, I can't remember, best I recall, sort of like a distinction maybe, or in analyzing or comparing our profession against maybe like surgeons and stuff, like the amount of stress that we're involved with, whether we're trying a case or they have someone on the table. And then you later on sort of discussed sort of the love-hate relationship that society has with our profession. I think that has a lot to do with maybe any sort of increased stress that we might have, because there's so many medical studies, at least my basic understanding, that say, hey, the mortality rate for this instance when diagnosed at this age is X amount, and we can never guarantee a result because
Absolutely.
we don't know what the judge is thinking, or 12 crazy people that are supposed to be the peers for our clients are thinking. And then you couple that with, you get what you think is a good result, but then your client looks at that last invoice or thought that they should have gotten better, or even in worst case scenario where they actually agree to the settlement and then they hate you for agreeing to it. It seems like you never win for them, you know, and I shouldn't say never, but far more often than ought to be the case, they feel like they didn't get the
Yep.
best result, because there are no sort of mortality rates
Right.
or success rates that you can point them to.
Right.
And I think, you know, that adds to our stress in,
Yeah.
in this sort of love-hate relationship with even our own clients.
Yep. I think you're spot on. I think that's why one of the comments I made earlier was that your profession and our profession in psychology, psychiatry are very similar, in that people want us to give them the roadmap. And they want us to say, after 6 sessions of family marriage therapy, your marriage will be back on track. Don't worry about it. Well, we can't say that. And you can't say it similarly, you know, to your clients. A surgeon can say that. You know, my mom is going in for a lumpectomy at 80 years old. Surgeon said, this is the likelihood that you'll have a recurrence. You know, it's between, you know, 3% and 6% for an 80-year-old. That field is much more precise. Our field, we live in a world of people demanding and hoping and wishing and putting that all on us to give them the outcome that they hope for. And we just can't do it. It just doesn't work that way. Yes, ma'am.
Has there been any comparison between the numbers here in the United States and those of attorneys in other legal systems in other countries?
That's a good question. I don't know, and I think the fact that there was a 25-year gap over here, there may have been something happening in that intervening 25 years overseas, but I don't know that it's been done like this. This is getting a lot of attention because it came out of Betty Ford and the Hazelton folks, who are fairly well respected. But I don't know if there's been like a comparative, you know, analysis and other.
I'm wondering, quality of life, the legal system, the demands,
Yeah.
cultural.
Yeah, absolutely. You know, and your clients, you know, who your clients are and the demands that they're placing on you. Absolutely. But I do think there's a lot that you can't give that guarantee. You know, no matter what, you just can't give a guarantee, and that's what people look for. Especially when they come to you, you know, when they come to us, people who come to therapy are rarely coming to be Maslowian self-actualized. They're coming because they're a mess, you know, and well, most of them are coming because there's an untoward event that occurred. You know, and guys who come to lawyers, I mean, they come to you in some level of distress. You know, they want some kind of resolution, some kind of peace, if you will. So yeah, you know. All right, any other comments, observations? Just be mindful, particularly for your younger men and women in your practices. This is significant data out there that's just now, it's only a year old, it's just starting to make the circuit, but it really is important for your profession. So again, thank you guys for coming out. Definitely appreciate your time. Thank you.